So our incumbent this time is Mitch Greenlick, and he's going to do the same thing, I guess.
I will do the same thing. I'm honored to follow Tobias, who's one of the great young legislators in our session. I'm Mitch Greenlick. I'm from House District 33. House District 33 is basically almost everything with a northwest address. It starts at the river, goes out Skyline, out Burnside, all the way out Burnside west. At 143rd, it cuts over to West Union, goes out west, and it's everything north of that. So it's about 40% urban, about 40% unincorporated suburban, and about 20% rural, very much like the state as a microcosm. Politically, it's about half the voters are Democratic, and about half the about a quarter of the voters are Republican, and about a quarter independent. So it's increasingly a Democrat district. It's also 50% Multnomah County and 50% Washington County. So it's a very interesting race, and I have 3 school districts, for example, to represent. It gets a little complicated dealing with the diversity, but it's also great fun. For those of you that don't know me, I spent about 30 years as Vice President for Research of Kaiser Permanente, and another 10 years overlapping as the Chair of the Department of Public Health and Preventive Medicine at the medical school. I'm a Democrat, but I represent my whole district, and I work very hard to represent the Democrats, the Republicans, and the various forms of independence we have, or various forms of not otherwise identified. And I campaigned on being able to work across the aisle, and I've worked very hard to maintain that ability to work across the aisle. I served my first 2 sessions in a Republican majority legislature, and I passed 8 bills in my first session out of the minority and 5 significant bills in my second session out of the minority, because I was able to work across aisles in a very effective way. And in the last session, when the Democrats took over the majority, I became chair of the House Health Care Committee, and that was very important to me. While representing my constituents is my job, health care is my passion, and I worked very hard to improve the healthcare system in a variety of ways. In my first session, the first time I appeared before this group in 2000, when I was running for the first time, the first question that was asked by a member is, what do I think about the rights of citizens to avoid being annexed to cities they don't want to be annexed to? And I heard that question the first time, the second time I was here, and I began working on behalf of my constituents in that to assure that Oregon residents would not be forced into annexations that they did not want to. I think annexations are important because they're a choice of government as well as a choice of who you pay taxes to. And I feel we ought to have the opportunity to determine the way we want to be governed. And I've worked in my first 2 sessions on the Land Use Committee. I was vice chair of the second session, and worked hard to prevent a variety of bad kinds of annexations issues, like island annexation, which is where a community will annex this street and this street and this street and say, oh, okay, you're now an island, you need to come in, without having any choice of whether you want to join Portland or Hillsborough or Beaverton or whoever it was that managed to circle your neighborhood. I also know that jobs are important to Oregon, and that business is important. And this part of Washington County is the incubator of new companies. If you start looking at the history of Tektronix in its early form and Intel as they've moved in, and watch the small companies that have emerged around these giants in Washington County, getting capital is a very important thing. And on behalf of Associated Oregon Industries, I passed House Bill 3613 in my first session, which requires the Oregon Investment Council to include in its alternate investment category, and particularly in its venture capital category, the requirement that they invest about $100 million in emerging Oregon industries, because emerging Oregon industries have had a lot of trouble getting venture capital, and because of that, a lot of the new companies move to San Jose or to Austin or to Boston, where capital flows much better. So I've been working with the Treasurer to try and keep that moving, and it's very important. On the healthcare side, I've done a variety of important healthcare bills because my constituents have asked for it. We had a storm of interest in getting hospitals to report on hospital-borne and hospital-based infection. As many of you have heard, the Institute of Medicine of the National Academy of Science, of which I've been a member since 1971, reported that there's 100,000 people that die in hospitals. That would be 1,000 people in Oregon that die in hospitals because of mistakes that hospitals have made. And one of those issues relates to hospital-based infection. So I have a full range of bills in that area. I created the Oregon bulk purchasing pool so people could save millions of dollars in Oregon as a result of that if they have no health insurance. And we'll be working in this next session. I helped create Senate Bill 329 that developed the Oregon Health Fund Board, and we'll be working this year to improving, as Tobias said, the healthcare system, reducing costs, improving quality, and getting some of those 600,000 people into the system. Thank you very much for the opportunity.